Um, Thanks, Victoria. Just got the notification. So since we're talking about integrated care, we have to talk about, then we have to define what integrated behavioral health is. And we have our definition, and it's a definition that was created by the Agency for Healthcare Research and Quality through their stakeholders' input. And it is the care that results from a practice team of primary care and behavioral health clinicians who are working together with their patients and families using a systematic and cost-effective approach to provide patient-centered care for a defined population. So when people think about integrated behavioral health, they just think about mental health, but it's so much more than that. And that is why this was established. So all of the three components, the mental, behavioral, and physical health, could be addressed in one place in a primary care setting. Now, just a little background of Project ECHO. I'm sure some of you have already attended or are still attending our Project ECHO series that is focused on integrated healthcare. This Project ECHO will focus on behavioral health consultants and their multifaceted role in primary care setting. So again, Alina will talk more about that, but just to give you a little background of what Project ECHO is and how it came about. Project ECHO was founded by Dr. Sanjeev Arora in New Mexico to ensure that the right knowledge existed in the right place at the right time. The ECHO model is the all teach, all learn approach, which started out as an infrastructure for knowledge sharing in rural and underserved communities around the world. Today, this model is used worldwide in a variety of sectors as a platform that really connects the group of community providers and specialists at the Center of Excellence in regular time collaborative sessions using Zoom. So they've been using Zoom even before we ever started. So they were definitely ahead of our time. And what ECHO does is it really allows experts and participants to connect and learn from one another through their shared experience and access critical and life-saving knowledge while receiving mentorship and ongoing support to make a difference in their community. So as I mentioned earlier, this ECHO will focus on multifaceted role of behavioral health consultants. We've worked with the experts to develop a very comprehensive curriculum and roll them out in ECHO platform, and we've made sure to cover the important things that the practices need to know and learn about infrastructurally to prepare and have your team ready for integrated behavioral health. So the ECHO format is first instructed by a subject matter experts. We have experts that have been doing integrated care for at least a couple of decades, and these experts are people throughout the nation. And we want to provide our participating organization with the support they need. Therefore, sometimes even after the ECHO sessions, we can connect these experts, and they're available to provide their knowledge and resources to you and give you all the kind of support that you need in your integrated care expansion. But during the session, they typically do 20 to 30-minute didactic session focusing on the subject areas and share their knowledge and understanding of the topic. And the rest of the time is focused on, it's dedicated for case consultation, questions and answers, and conversations. And that's where people have really found ECHO to be enriching and really a great learning experience for the work that they're doing in integrated behavioral health. So with that, and without any further ado, I'm going to pass it over to Alina, who is going to talk about our announcement and discuss more in detail about the ECHO series.
Thank you so much, Sujina. You did awesome. So, okay, so we are finally here at the part that you guys have all are here to learn more about. So before we go into detail about the Project ECHO series focused on BHCs, we have an exciting news to share, and that is that Integrated Healthcare Initiative will be launching our very own Behavioral Health Consultant Certification course in Q1 of 2023. So next, please. And so earlier, Sujina spent some time talking about the integrated healthcare framework. And in that framework, or within that framework, team-based care is prefaced. So if you guys don't know, behavioral health consultant is part of that framework because they provide their experts in social, behavioral, emotional, and psychological aspects of health. And so Like Sujina said earlier, a BHC's role within a primary care setting is quite multifaceted and needed. Unfortunately, though, we don't have enough behavioral health consultants to go around all of our primary clinics to treat patients with behavioral health or mental health issue, which is a necessity for a successful integrated behavioral health practice. So for that reason, this program is designed to improve the gaps in providing and receiving behavioral health consultation services in primary care. And through this course, we strive to train behavioral health consultants that are competent in addressing health disparities and improving health equity and promoting health in vulnerable and historically excluded populations. So before we move on, I think there's one thing that I have to make clear, and it's that this course is specifically targeting behavioral health professionals who are licensed social workers, psychologists, marriage and family therapists, as well as professional counselors. However, to clarify further, our ECHO series is completely separate. While it is connected, it is separate from the course, and our ECHO series is open to anyone and everyone that is interested and would like to learn more about how a behavioral health consultant can really be integrated into the new framework. And so in preparation for the launch of our BHCC course, we're starting off with the small series of Project ECHO focused on BHCs, which will review the roles of how they can be of help in a primary care setting with real life applicable scenarios. So more about our Project ECHO. So our Project ECHO will contain 6 or more sessions. So starting in July 2022, so next month, we'll be officially kickstarting our sessions with an expert presenting, which leads to question and answers, and it will be hosted on every second Monday of every month, starting at 12 p.m. to 1:30 p.m. Central Daylight Time. So we also have experts speaking to us about experts presenting on these different topics. And like Sujina said, every ECHO has a format, and we have adopted that format, except ours is a little bit more stretched out. So the first 40 to 45 minutes will be led with a didactic and interactive presentation from the expert, and the remaining time will be used for discussion and Q&A. And as always, we will be giving out CEU credits as well. So now that we have talked a little bit about the logistics of the course, y'all must be curious about what are some of the topics that we'll be discussing? What are some of the concerns that will be addressed regarding or revolving behavioral health consultants? So as you can see here, this slide will display, this one and the next one actually will display the topics that we presented with their respective dates as well. So the first one being how behavioral health provider operates as a behavioral health consultant in primary care. And personally, I think this is a really important topic for our expert to talk about, because we've had a lot of questions in the past where a lot of us have asked us, hey, what are some examples of how a behavioral health provider can perform, or what are some things that they can do in a primary care setting? And the next one will be on how BHCs can help with ethno-racial health disparities in primary care. The next one will be how they can assist with vaccine hesitancy considering COVID-19. Then they will be addressing the health outcomes associated with social determinants of health, how they can help with behavior change and chronic disease management, and lastly, how they can be of help in a rural and underserved settings. And please note that there might be a chance that our series might not be limited to these 6 sessions or these 6 topics, but if anything changes, we'll be sure to communicate that with you if we decide to extend our session. And for now, for our experts, I want to put them on the spotlight here. We have, unfortunately, unfortunately, we have all of our speakers join us today for the information session. So I will go ahead and introduce them by name, and after that, they will have a few minutes to speak about their background and or a brief overview of the topics that they will be presenting on. So our first speaker is Dr. Stacy Ogbite. So I believe she's here. So Dr. Ogbite, whenever you're ready, please feel free to take over.
Sure, thank you. I'm happy to see so many people on this call. That is amazing, and I hope even more people watch the recording afterwards. If you don't know me, I am Stacy Ogbite. I am at UT Health Science Center in San Antonio, Texas, in the Department of Family and Community Medicine. And I'll be helping with this project in two pieces. One, I'll be teaching some of the ECHO sessions related to BHC work. And then the second piece, I will be the faculty lead on the BHC certificate program that will be kicking off soon as well. And so very excited to meet all of you or your colleagues, if other people on your team will be joining us either for the ECHO or the certificate program or both. And so very excited to be here and learn from everyone here. So thank you.
Thank you so much, Dr. Ogbite. And next we have Dr. Ebony Winford. I think she's here. I can't tell.
Right here.
Awesome. So the floor is all yours.
Hello, everybody. Nice to meet you. I am also very excited to be involved in this. I'm going to be talking about the ethno-racial disparities and ways that we can address that in primary care. And if anybody has ever heard of my name, you should know that that is my jam, and I can talk to you about that all day, every day with no apologies. But just so you know that I'm a BHC here at Cherokee Health Systems, where I'm also the Director of Research and Health Equity and one of the trainers for our national consulting program. I'm the clinical director for that. And so I get lots of opportunities to teach about integrated care, and I'm excited to be here with you. And I will also be participating in the BHC certificate course. So you'll get to see us a whole lot if you decide to do that as well. Thank you all for having me.
Thank you, Dr. Winford. And lastly, we have Dr. Meredith Williamson. Dr. Williamson, are you here?
I'm here.
Okay, awesome. The floor is yours.
Hi, everyone. I'm excited as well to join. And with the others, I'll also be participating in this ECHO and in the certification or the certificate course. I'm at Texas A&M Health Science Center in the Bryan College Station area. And I direct integrated behavioral health training for medical residents and psychology graduate students and social work graduate students. And then in addition to that, oversee other aspects of residency training for the medical residents. But for me, I work in a more underserved rural setting, being in Bryan College Station, which is in the center of Texas, for those of you that may not know where it is. And so I'll be talking more about what happens when the BHC is often the only resource for patients in your community. And so oftentimes we consider integrated behavioral health in the context of larger healthcare systems. But what happens when you're it, and how do you function, and how do we address mental health, behavioral health concerns in a brief setting while still being able to care for them longer term?
Thank you so much. All of these topics and all of the expertise coming from these professionals, it's just very cool to me as I'm still completely new to this field. So I'm definitely excited to learn more from each of these individuals as well as work together. And I hope that you all will join us too. And again, thank you so much, Dr. Williamson, Dr. Winford, and Dr. Ogbite for joining us. I know it's truly been a pleasure to have you all join amidst your busy schedule. And moving on, now we have almost reached the end of our presentation, almost, but not yet. So we have a couple more slides to go through, which will have a few more logistics aspects, and then we'll open the floor for questions and answers. So this is the QR code for our consultation course. If you have a minute, please feel free to open this up on your phone. You can scan it in your Photos app. And Sujina will also be sharing her screen shortly. So feel free to engage and fill this out if you have any questions right now. But before I say that, I know that I have to talk about the purpose of the consultation forum. So the purpose is that you as the audience will get a chance to ask questions or concerns that you would like for the experts to address either during the presentation or after the presentation individually, like one-on-one basis or not, whatever you prefer. So this is what the form looks like. This is both in how it looked like on a web-based platform as well as a phone screen. So as you can see here, we have listed the topics that we'll be discussing with our ECHO session. So feel free to, if you are going to fill this out, feel free to select the topics that matches your concerns. And if it's not there, feel free to pick other, and it'll take you to the next page, which will actually ask you for you to describe your case. So it's an open-ended question. So please feel free to provide us with as much information as you can revolving your case, your struggle, your challenge, whatever it may be, so that our experts can understand the full story and can also give you the best knowledge they can to support you. And there was also a strategies page, and in that part of the questionnaire, you can also talk about what are some of the strategies that you used, what worked, what didn't work. And again, it will help the expert to get the bigger picture of what's going on. And, you know, the more they know, the better they can help you. And so this is a really four question survey. And the last part of it is just to put in your name, your organization, your email. And this is really important if this is something that you want them to reach out to you personally or help you out on a one-on-one level. But of course, if that's something that you prefer, feel free to put it in the additional information. So once this process is done, we will share the questions with our experts, and then they will either again discuss it during the presentation, or they will email you or reach out to you for further clarification. And we truly believe that the consultation forum is a beneficial platform for you all to utilize, as it definitely connects you with the experts and gives you an opportunity to expand on your cases regarding integrated healthcare or BHCs. And before I forget, you might also be wondering how you're going to get access to the link or the QR, or apart from the QR code you see here. And so to answer that question, we will actually be sending you reminder emails a week before and the morning of each of our sessions. So Sujina, correct me if I'm wrong, but we'll also be putting these links in either of those emails. So please be on the lookout for that if there is something, or go ahead and put something in there now if you have something that pops up in your head at this moment when you got reminded from what the experts had to share. And in addition to the consultation form, we also have an evaluation survey, and this comes after the session is done. So once you complete the meeting, we will be sending out evaluation surveys, which gives the audience the opportunity to provide feedback, as well as give us insight on whether your knowledge has improved on a particular topic. And this is our only way of collecting data, and we want to know if this is helpful for our participants. And the evaluation survey will also be sent alongside the CEU certification upon completion. So that's all for this slide. And then really quickly, we have also included the registration link for our ECHO series, again, starting next month. Sujina will also be dropping it in the link to the registration in the chat. So if you want to take a minute and scan this link will take you to our registration page where you'll be automatically enrolled for all of our series. So please feel welcome to register to this link or share this with anyone you might know that might benefit from the series. And so this actually brings us to the end of our information session. Thank you all so much for joining us today to kick off our BHC Project Echo series. We're really excited to see what this brings, especially with the course on its way. And yeah, if you guys have anything, and Sujina, was there anything that I missed or anything that you'd like to add before we open the floor for questions?
No, I think you covered everything, but as you mentioned, I would be very happy to see you all if you are interested in our ECHO series. And of course, if you're interested in participating in our BHCC program, more information on that in the later days. But if anyone has any question, we're happy to answer them. Feel free to unmute yourself or type it in the chat box.
Does anyone have any questions for the experts as well before they leave? This is your opportunity to talk to them and conversate. Is there a fee for this course? Yes, there will be a fee, but nothing has been finalized, so I would not be the best person to leave a comment. But Dr. Stacy or Sujina, if you guys know more about that aspect, please feel free to share.
Yeah, I don't know if Sujina, if you're going to jump in about for the certificate one.
Oh, you can go ahead, Dr. Ogba.
Okay, perfect. So right now for the first iteration of this, because it is a pilot, we have a small number of individuals that will be enrolled, but as of now, there won't be a fee for this first iteration of it. So it's actually quite awesome that you would get this training. The only fee I would say is that there will be a point in the certificate program where you will travel to Houston for in-person training with patients, so you can use the BHC skills that you're learning throughout the course to put them in action. And so the cost of, if you're not in Houston, if you have to travel, get a hotel for the night, so things like that you would cover. But in terms of an enrollment fee for this first iteration, there isn't. Depending on how this first iteration goes, if we offer this yearly, in the future, there will probably be an associated fee to cover the time of the instructors and all the other components of the course. So hopefully that helps people for this first iteration.
No, yeah, that's so helpful. That's something that I didn't touch base on. So thank you so much for that question. And someone asked, if you're interested, do I leave your email? And when will this happen? So this course will be launched in Q1 of 2023. So somewhere in the first 4 months of next year, we don't know yet. And if you're interested, I can definitely, I have an interest spreadsheet, so I can definitely take your email address and put it in our interest sheet. And once we actually know more about the course, I'll be sure to personally send you an email to tell you that, hey, we're up and running, feel free to enroll and yeah, share more information, but also please feel free to look out for any of our newsletters. If you guys are in our IHC network, we'll also be making that announcement in our newsletter that goes out like the beginning of every month. So hopefully that answers your question. And then Dr. Ogba, there's another question that asks how many sessions is in the course?
Sure. I will say briefly to the other question, if you do want to be on the list that we email first, you put your email address in the chat box and put, I would like to be added to the certificate list. That way you are in the know a little bit, so you get at least some good things of coming to the live Q&A. You get to be on the list, but of course it will be on all the email blasts that MHA does. But just letting you know, if you'd like to be on the list, I see people typing their email in there, so that's great. So the other question, how many, so we have 5 modules for the course. Each module will take about a month or 2 to complete. So we expect the full course will take about 10 or so months to complete total. There is an intro module plus 5, so essentially 6 modules that you'd go through. And then in the middle of the module, so about between module 3 and 4, something around that time is when you would travel to Houston to do the in-person skills lab, which would happen over a weekend. So hopefully that helps.
Yeah, we're seeing a lot of emails, so that's really good. And this session is recorded, so we'll definitely be able to get all of your emails, and we'll reach out to you once we know more and as we get closer to our launch date. Any other questions regarding the ECHO session?
I see a question about the
The lab,
skills
yeah.
lab. Yeah. So the skills lab would be an all-day experience on a Saturday, for example. And you'd be working with, I don't know if anyone's ever worked with standardized patients before, essentially patient actors, individuals who are trained to act like a patient. And you would work with them throughout the morning and afternoon with coaching from the instructors. We'll have instructors there in person as well that will do some skills teaching and then practice with the patient skills. So it's a lot of hands-on exposure. What we really wanted to do differently with the certificate is not just give you the information, but actually give you the knowledge and build the skills on how to actually use it with a person sitting across from you, and then get direct feedback with the instructors watching you do the visits. And you get feedback from the patient actors too. They'll definitely give you feedback about how you did as a BHC. So that's what that day would look like, very hands-on skills training about how to do initial versus follow-up visits, different presentations, adult, pediatric, dealing with things like depression versus diabetes. So hopefully Oscar Carlos, hopefully Carlos, that answers your question.
I also just listed the link for the registration for the ECHO series. So feel free to click on it and register. And once you do that, you'll be receiving an auto confirmation email. It'll also have all of the Zoom link related to our entire ECHO series. So just be on the lookout for that as well.
And there was one more question, which goes back to the certificate course. And it's from Oscar asking that he would like to know more about enrolling into the certificate program. So this actually comes back to us like not knowing just yet how we're going to implement all of this regarding our course. So once we do know more, we'll be sure to reach out to you and everyone that's on the interest list. So thank you all so much for giving me your email addresses and more information about the certificate program. We were honestly, I think we're out on like most of the detailed information. So yeah, we'll be sure to reach out to you specifically, or you can send us an email at IHCI at mhahouston.org, and we can give you answers through there as well. So just reach out to me. I'm also I'm working alongside Dr. Stacy as well as our director to implement the BHC course as well as the Project ECHO. And so just give me an email and I can definitely reach out to you with the best of my knowledge that I know and I have. So yeah, was there anything else that you guys would like to add?
I see Oscar asking any prerequisites. The only prereq there is that there is an introductory module that goes through what the certificate will entail. And so that's to kick off being in the program. So we do require that people do that before you actually start the certificate program. It'll be online, self-paced webinars, so you don't have to travel for that or any of the other modules. It'll be all online. And so once the information gets released later this year, you'll have all those details, but that's the only prereq. But we'll offer you the prereq, so you'll be able to do that, no problem.
Right. Yeah, I hope like that's all the questions that we have for our information session. So I think we can bring it to a close then.
Yeah, I think we've answered all the questions in the chat. If you have any follow-up questions, feel free to reach out to us, and also be on the lookout for our newsletter. We provide our any upcoming announcement in there. But we will definitely reach out to you once we know more on, once we are ready to announce more about the BHCC course. But thank you all for joining today, Dr. Ogbai, Dr. Winford, and Dr. Williamson. Thank you so much for making the time to be here today. We really appreciate it. And it's always a pleasure to see you all. And thank you all so much for joining. Hope to see you all in our ECHO series. The first one will start in July. Alina, do you know the date of that?
July 11th of
July
next
11th. Yes. And we're also doing another ECHO series simultaneously. So we hope to see you in all of them. But in the meantime, have a good one all. Take care.
Thank you.
Bye, thank you.
Bye, Sarah.